Good evening, everyone. Welcome to the very splendid and scintillating session called Career Opportunities in Research after Pharm D and another Pharm D degrees, Walk of Life through the Province of Research, conducted by CliMed Research Solutions in collaboration with IPASF, Indian Pharmaceutical Association Students Forum. Interested in research but worried what will you do after Pharm D? Don't sweat it. This session would be your answer to all the problems. I am Yutika, a research intern at CliMed Research Solutions, and I will be your host for today. Let's slide into our first session, which will be taken by Dr. Ajith Singh, who is also our mentor.
Thank you very much, Yutika, for the nice introduction. Welcome everyone again. So I'll start this session. Actually, I'll not take more than 20-25 minutes because I'm speaking only on the PhDs or research activities after PharmDs or after any pharmacy degree, right? So I will start with myself. When I was finishing this my course, so I went to PhD in cardiology, and that was, I think, first time in India that someone has shifted from pharmacy college to a medical college from this batch, from this like PharmD thing, right? And usually, the second thing here, we actually get many times and many people, they come to us with only one question: so that we have joined PharmD, what to do after PharmD, what to do after PharmD and how to proceed after PharmD. We have joined this course, but we are clueless now. We do not see much scope after this course. Guys, I'm telling you, PharmD, a doctor of pharmacy, as we all know, this is a 6 years course and 3 years course. 3 year is after Bachelor of Pharmacy, the lateral entry, or we also know as post baccalaureate or PharmD PB. So in India, I feel in pharmacy there is no such course. There is no such course which is this much diverse. PharmD is so diverse, and people after PharmD can do anything. For an example, if someone is doing a Bachelor of Pharmacy, right, and then they have to go for a specialization in masters, like for pharmaceutics, regulatory affairs, pharmacy management, or pharmacology, or there are regulatory affairs. So uh, there are many things. They have to choose one out of them, and then they have to go for the specialization, right? And then after that specialization, they'll be limited to do research in that area only. It's not like that they are restricted, but they usually can do the research only in that area. If they are in pharmaceutics, they can work on formulations, or they can work in the R&D, or if they're in pharmacology, they can work in pharmacology stream only. So it is very tough to make a transition after that master's degree to a PhD. Like if you are pharmaceutics M.Pharm, and now if you want to do pharmacology PhD, it will be quite tough for you, because you have to change your whole stream. You have to think of 100 times. But guys, after PharmD, the first advantage is that you need not to go for master's degree. If you want to join PhD, you can join PhD directly after PharmD. No need to go for masters, right? Of course, it is a six years course, or after bachelor's it will be 7 years. But I'm talking about diversity. After PharmD, if you want to do PhD, you have limitless streams, limitless domains to do your PhD or to do your research. You can join pharmacology, you can join pharmacy practice. I'll come to the advantages one by one. So I mean, as I've seen, many of the students are hopeless, clueless that what to do and how to do and where to go, which stream to choose. So we'll discuss one by one. First, you have the diverse domains to choose after PharmD for your PhD or for your research. I'm telling, right? You can go for pharmacy practice, you can go for pharmacology. If you are interested, you can go for pharmaceutics, you can go for regulatory affairs, you can go for health economics, you can go for pharmacy management. So it is limitless. You are not restricted to any pharmacy stream or any pharmacy field, right? It is just about your interest, where you're interested. If you want to go to industry for research, you can go, right? Because you are expert of everything. You have learned all the streams of pharmacy in 6 years, right? Of course, they are focused on therapeutics and they have much focused on pharmacology and clinical pharmacy. That is an added advantage. But if you are interested in pharmaceutics, no one can stop you. If you are interested in regulatory affairs, no one can stop you, right? You can go anywhere in any stream. You can join any stream of pharmacy. You can join. Now, especially as pharmacy practice is known for, this PharmD is known for pharmacy practice or clinical pharmacy. The added advantage here with you is that you have the patients with you. You have the clinical side with you to do research. In clinical side, if you come now, there are all the medication or all the medicine related field, all streams of medicine are open to do research for PharmD people. Not only pharmacy, now medical field. Because you are from the clinical pharmacy, you are from the pharmacy practice, you are dealing with patients, you have patients with you to do research, right? You have the hospital to do research. And that advantage is really not there with someone who is working in pharmaceutics or who is working in some specific field. But you have that, you have that because you are specialized, you are specialized for that only. So you can pursue your research in cardiology, you can pursue your research in gastroenterology, or you can do in psychology, psychiatry, or anywhere, wherever you want. You can do in nephrology, cancer, I mean, this oncology, anywhere. It is up to you. It is all about your interest, where you want to go, where you want, from where you want to start. So you have those a full diverse thing with you. So first, pharmacy, any field you can go. Second, medicine, you can go anywhere, and you can go in community medicine, you can go in community pharmacy, you can go even the public health. Now third domain is public health. You can go to public health and you can choose anything. You can work on the registries, you can work on the public health domains like tobacco use, or any public health issues you can do. You can pursue your research, right? And then the fourth thing, you're not only limited to these things like pharmacy or medicine or public health. You can go to the technology. If you are interested, you can go to the technology. Nowadays the technology is emerging in all the fields of medicine and pharmacy, all the fields almost. And then why it is very beneficial, or you have the advantage. Why it is? Because you are associated with patients, you are associated with that healthcare system, right? You are associated with the healthcare system directly, you are associated with the patients directly. So if you have heard of, if you are aware of the AI, artificial intelligence, or any kind of technological tools they are developing for the ease of healthcare system. So there is there is your need. You can go there, you can join them, you can do research there as well. You can pursue your PhD in the technical field as well, right? So you are not just limited to pharmacy, medicine, or public health. You can even go for the technology, any field of technology, like it is related to maybe AI, or any tool making, or anything which is which has some relation or association with any kind of medicine field or any kind of pharmacy. you can join them, right? So these are the advantages, and this is the diversity of Pharm D, you know. And after this course, you can just, you have to, I'll say you have to explore your interest. You have to explore your interest, and you can join anywhere, right? And for the PhD, I'll say, see, when someone after B Farm wants to go for PhD, they have to do masters, as I told, but you can join directly, right? Then the second, and the second domain where I want to talk to you is like how to go into that, you know, how to go into the PhD. That I just discussed about the domains and the stream, that how diverse PharmD course is, but now how to land up into the research. So when you are in fourth year, or usually the first year of your PB, post baccalaureate, I think you get one project. 6 months of the project is there, clinical related project. I will not say that choose your future on this project only, but at least do it with your interest, do it with some enthusiasm, so you can learn something about research, right? It can be used anywhere in the life, it can be used anywhere in your career, you know it can be used anywhere. See, I'll tell about myself. When I was in fifth year, I did my project in infectious diseases on MRSA, methicillin resistant Staphylococcus aureus, right? But after that, I mean, that was not my interest. That was given by the, my mentors, because they were interested in that. Of course, you will get that type of situations also, but you can learn from that. You can learn from that. You have the diversity. You can learn from that. So I did on MRSA. Later I thought like, okay, let's continue with this only. Let's continue with the infectious disease. Later, when I came to my internship, first 6 months, I used to go to hospital, and parallelly I was doing some research on H1N1, right? And then I have published in the reputed journals that, okay, and but I was interested in cardiology. I was interested in cardiology. So you have to find out your interest also, as well. Like if you want to go for industry, or if you want to pursue, your career in academics or in research. Frankly, if I tell, I did not know. Even I did not, choose to go to research when I was in first year of, my post baccalaureate. I did not. But I used to go to the ward rounds, and I'll tell you some starting. I used to go to the ward rounds, and we saw like, okay, there are few cases, there are good cases, and like where we can learn many things. We used to ask clinicians, and clinician used to ask many questions to us. I mean, we were not aware of the questions, but I used to read. I used to read a lot about this case. Like, okay, what we have discussed today with the physician, what did he ask us, and how to answer tomorrow. I used to predict like, okay, so next time he will ask something else, or next day when he will ask, he can repeat the same question. But I should know, if I couldn't answer today, I will answer tomorrow. I used to read. So in that hunt, I used to go through the research papers. Not only the books, research papers, and then I used to go some case reports, and original research papers, and some systemic reviews, and all these are the types of research papers and manuscripts. So I used to go some case reports. So I have seen one case, very interesting case of actually HIV, and that case had many problems. That case has many other opportunistic infections, like herpes simplex, and then tuberculosis, and that tuberculosis was disseminated to the brain and kidney and other parts of the body. So I just thought like, okay, let's give a try with this case. Let's try to learn it completely. I took almost a month to like find out everything about that case, and to learn, and to get into the a picture of at least a clinical case. If you ask me the clinical case, how to dissect the clinical case. So I took around 20 days to 30 days. Then I simply asked her, can we give a try to publish this? And you won't believe that was published in BMJ. My first case was published in BMJ. Okay. And after that, I thought research is very interesting. I really, I like find research is very interesting. And then I had some, I had that special love to cardiology. So I started going to cardiology just for the, just to see the patients normally, and just to, interact with the patient records. So I used to go and I used to find out the research. I used to find out the different scenarios of cardiology in the files. And then I got into like, okay, heart failure is something which is very interesting. And there are other domains also, but I found like, okay, heart failure is good. So I started talking to their HODs and other people who used to take the rounds and all. Then I took my then I went to cardiology as intern for some time, like 3 months. And you won't believe, guys, I find it very interesting, very very interesting. And I started my interest in cardiology. So as you know, there are I think 5 domains, 5 streams. We have to go to the in our internship we have to cover 4 to 5 domains in 1 year. So they used to send me psychology. I used to cover that in 2 3 hours, and I used to go to cardiology. I used to spend the whole day in cardiology. And then it is just because of your interest. When I was going through the literature, I was going through the papers and all everything. So I came up with something that, okay, this area has not been covered in pharmacy, in pharmacy practice or in clinical pharmacy, along with the this cardiac patients, along with these heart failure patients. So I have discussed this idea with my mentors in cardiology. So they found it interesting, and then we wrote some grant. We wrote some grant, and that grant was actually huge because that idea was actually huge of conducting a registry study in India. Conducting a registry study in India. So when we submitted to 4 5 organizations, 4 5 funding agencies, actually 6 funding agencies, and we got a positive reply from 3, and they gave the huge funds to conduct that registry. So you know you won't believe that fund was really around 1 crore, and the huge fund in research. And immediately I got the position of research associate after that, and then I started my PhD in cardiology. So you have to come up here something good. Like your idea should be relevant, your idea should be really good. So for to get a good idea, to get something really good for your PhD or for your further studies after PharmD, you have to choose it in your internship or before. Like you have to you have to read, you have to gather the correct information, right information, and then you have to come up with something very interesting. But for that you have to read, you have to focus on something very specific. You have to go through the literatures, books, and you have to narrow your research at one point. Like, okay, you are in cardiology, then in cardiology which domain is good, and then in that domain what is the area where research is not done yet, or which is untouched with the research, right? So you have to go to that, and you have to find out that area, and you can pursue your research. And in India, guys, I'll tell you, I have moved from the pharmacy college. I did not pursue my PhD in pharmacy college. I have pursued my PhD completely in the medical college, Kasturba Medical College, Manipal. So you have that chance. You also have that chance. You can choose your college also. You can choose your good mentors. You can go for any stream. But before that, you have to read good, and you have to find out the good and interested topics, good and interested research area. And in India, I will tell you right now, there are almost 100 universities which are offering PhD for PharmDs in clinics, in pharmacy practice, in technology. Even my friends are doing PhD in IITs, right? You can't believe what people are doing. PharmDs are doing PhDs in IITs, IIT Madras and IIT Kolkata. I know people are working, in medicine, people are working in nephrology, people are working in cardiology, people are working in different domains, right, in the research, and they are earning well, right? So if you are interested in research and if you want to pursue your career in research, this is nothing like you will not get money. Money, of course, everyone wants money after that. So this is not just, don't restrict yourself to, become a clinical pharmacist or to become a soap, shop owner something. So, but you can, you can think of this research area. Research area is really good, and you can really make the huge impact on pharmacy field and medicine field if you are really interested in research, right, guys? So I'll not take much time now. That's it from my side.
Thank you so much, sir, for such inspiring words. So as sir has said, we'll take the questions at end of the session.